Now I'd like to introduce Dr. Charlie Lockwood, Senior Vice President of USF Health and Dean of the Morsani College of Medicine. Throughout our efforts to navigate through this pandemic, Dr. Lockwood has been our scientific and clinical thought leader in our understanding, our estimating, and our planning treatment for individuals with the virus. We simply could not have a more insightful and capable physician leading the university's medical strategy for tackling this virus. Charlie, over to you.
Well, thank you. That's really much too kind, and it really is my great privilege to lead a great group of physicians and nurses and other healthcare providers that are doing an amazing job, and so kudos to them. So just to give you kind of a little bit of a background. Most of what I'm going to say, I think, is a lot more positive than I would have said a week ago. So Florida right now has about 16,000 cases. We have about 2,100 hospitalizations, and unfortunately, we've had about 354 deaths. So that's all the bad news. The good news is that, in fact, the rate of increase of cases in Florida has been much less than we expected. It's linear, not logarithmic. We're increasing at about 7% a day in each of those categories, which is much less than up north for sure, and most of the country, in fact. Our best projections suggest that in Florida, our cases peaked on April 3rd. In Hillsborough County, they peaked on the 1st. So that's really good. The bad news is that hospitalizations and deaths are lagging indicators. And so we expect that the peak in hospitalizations will occur around 10 days from today, which is pretty close to what the University of Washington estimate was, which suggested we'd have peak resource utilization around April 21st. So it's pretty accurate, we think. Maybe a little bit more conservative than what we're projecting. And certainly in Hillsborough will be even earlier, and with much lower amplitude to that famous curve you hear about we're trying to flatten. So that's good news. As we look at the Tampa Bay area and we look at Hillsborough County, Pinellas, Sarasota, and Manatee counties, they have been relatively unaffected compared to, unfortunately, Miami-Dade, Broward, and Palm Beach, which account for about 60% of hospitalizations, 60% of deaths, and about 60% of cases in Florida. So our rate of increase in Hillsborough County has been particularly slow, given the size of the county. And we attribute a lot of that to the excellent approach that has been taken by our mayor and our county commissioners with their stay-at-home policies and an incredible compliance with that by the folks in this community. We've also benefited from a couple of other factors. We don't have mass transit, which is usually a source of complaint, but this particular situation helped us. And we don't have the vertical population density of places like Miami. The other thing that's helped us is our cases tend to be much younger. The average age of cases in Hillsborough County is 44, which explains why we have had such low hospitalizations and relatively low numbers of deaths. Our mortality rate is amongst the lowest in the country per case. Now it gets a little dicier as you go to Pinellas, Manatee, and Sarasota. The age keeps increasing. In the case of Pinellas, it's 52 is the average age of cases, 57 for Manatee, and 65 for Sarasota. And so their percentage of hospitalizations is higher, and unfortunately the percentage of deaths is higher as a result, but they're still relatively low compared to the rest of the state. So that's all very good. We will not exceed the available beds, ICUs, or ventilators in any of these counties, particularly in Hillsborough. And in fact, the census at Tampa General and Baycare has been dropping all week. Right now, TGH, as of about 4 minutes ago, had only 8 admissions, and of those, only 1 was on a ventilator. So that's much better than even a week ago. And we see that really across the 4 counties. So that's all really good news. And it suggests that the curve has been flattened. It's also been kind of moved to the left so that the peaks are occurring earlier than we anticipated. And so in general, we're quite excited about that. Now, the question is, when do we get back to normal? And if I knew the answer to that, I would be a regular on CNN probably. But we're beginning to get a good strategy together about how to get back to normal. And the first is the availability of antibody testing. So the current testing tests for the presence of the viral RNA. This is an RNA virus, and it tells you that you are likely to be actively infected. It doesn't tell you if it's negative that you didn't already have the infection or better and have antibodies. And so by being able to do antibody testing, we'll identify the significant number of folks that have not been tested and have been infected and are now better. And that's the first tranche of folks that can go back to work. And we don't know the exact number. In China, up to 85% of cases were undocumented. Based on data from Iceland and Germany and nations that have done much better job than we have with testing, we think that at least 50% of cases are asymptomatic. In this country, we've only been testing the sickest patients, the most vulnerable patients, hospitalized patients, and so we have significantly underestimated the number of cases. So there's likely a big population that has been infected, particularly among younger folks, that have had no symptoms or mild symptoms. And when we can confirm that they're immune, we can get them back to work. And that can start in the next couple of weeks. We've actually ordered kits already for USF Health and Tampa General, and we'll be starting testing next week. We've got to validate that having the antibodies is confirmation you truly are immune and that you're not expressing the virus. We'll work through all those studies the next week or two. But starting in a couple of weeks, we think we'll have enough confidence in these antibody tests that once you're tested, if you're positive and you're not expressing the virus, you can go back to work. So that's going to be the first group that goes back to work. And they're immune, they can't get reinfected, and they won't infect anyone else. The second group, as we get the famous R value, which is the number of folks that an infected person infects, well less than 1, which we're pretty close to. We actually think we are there, certainly in Hillsborough County. As that number gets smaller and smaller, and we can begin to move back to containment and contact tracing and really be sure we've identified all the cases and their contacts and the virus isn't spreading, then we can get those folks that are young and at low risk, under 65, no comorbidities, back to work. Now, they should continue social distancing and they should wear face masks in public, and they should definitely wash their hands frequently and use hand sanitizers, but they can go back to work. And then the final group will be the vulnerable group, 65 or with comorbidities, and the infections have to be rare for them to return to work. So we're looking at folks that are immune going back to work in the next couple of weeks to next month or so. The next group probably in about 6 to 8 weeks, the non-immune, low-risk patients, and then finally the vulnerable group probably in 8 to 10 weeks. And those numbers keep getting better as we look at where we are in this epidemic. So lots of, I think, good news, but for now, for the next month at least, continue your social distancing, continue frequent hand washing for at least 20 seconds with soap and warm water, sing happy birthday to me twice, that's 20 seconds. Use hand sanitizer, particularly when you're out in public. When you go to buy products, wipe them down with a disinfectant solution. So if you go to Publix or you go to a supermarket, wipe down those cartons before you open up any of the food. And it is important to maintain that respiratory hygiene in public. So when you're in a supermarket or the pharmacy, make sure you use a face cover. That is actually more to protect other people from you, because you may be infected and not know it. Remember, at least half of folks are asymptomatic. It's not so clear that it's actually protecting you, but it probably does that a little bit too. So I think that's pretty much what I wanted to tell you. Much more optimistic than I was a week ago. I think we have a clearer strategy for getting back to work. We are going to be watching carefully in the fall for recurrence of the epidemic, but we'll be in much better shape from a public health standpoint. We'll have many more tests available to identify folks that are infected. We'll have a lot more medications. We're starting 12 separate clinical trials right now at Tampa General with our physicians. Our problem is a good problem. We don't have enough cases to enroll patients, and that's a really good problem to have.